Okay, so I think we're at time. I'm going to get started. My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health, and I'm really pleased to welcome you to our Innovations in Tobacco Control seminar series. And today I have the immense pleasure to introduce our speaker, Shi Yin. Shi Yin is the regional advisor for the Tobacco Free Initiative at the World Health Organization's Western Pacific Regional Office. Previously, she served as the acting lead of the non-communicable disease team of the China WHO Country Office with a focus on tobacco use. And before joining the World Health Organization in 2019, Ms. Yin Shi worked at the Campaign for Tobacco-Free Kids and the Global Health Advocacy Incubator for 12 years. In that role, she and her colleagues worked closely with local governments, non-governmental organizations, and academic institutions to promote the adoption and implementation of tobacco control measures, particularly in China, Indonesia, and the Philippines. She has organized health policy advocacy trainings and media trainings for journalists in many countries. Ms. Yin has a journalism background. She also holds a master's degree in communications from Michigan State University and a second master's degree in public health from George Washington University. And so I'm thrilled that Shi Yin is able to be with us today and talk about use of electronic cigarettes among Chinese young people. So over to you, Shi.
Thanks so much, Joanna, for that introduction. Good evening and good morning, good afternoon, depending on where you are in the world now. I hope you and your family and friends are well. It's an honor to be part of the Innovation in Tobacco Control lecture series. The topic today is electronic cigarette use among Chinese youth. But we all know in recent years, e-cigarette is a topic that has generated so much attention and discussions. And it's certainly a topic that comes up a lot in the Western Pacific region of WHO, and especially in the tobacco control field. And having worked in the WHO China office myself, I had the opportunity of working closely with my colleagues at the China CDC to examine the data from the China Adult Tobacco Survey regarding the use of e-cigarettes. And I was asked to discuss the study we have done today. But I thought before we dive into that, it might be helpful for me to show you, to give you an overview of the prevalence of tobacco use in China. So the China Tobacco Adult Survey in 2018, which is the recent tobacco survey, showed that the prevalence of combustible cigarettes use continue to be high. So you can see here among males, it's more than 50%, and among women, females, it continued to be low, and it's about just 2%. So from 2010 to 2018, you can see a little bit of coming down, but this decline is really not significant, statistically significant. So it pretty much remain stable in terms of prevalence of combustible cigarette use. And this graph breaks it down by age group. The reason I want to show you this age group is I noticed something interesting. If you look at this, there are 4 age groups, right, in the China Adult Tobacco Survey. So the youngest group here, 15 to 24, has the lowest prevalence. And it's not so, of course, for people at in an older age group. And this one, there's a reason I want to show you this by age group, because I'm going to show you exactly the same thing by age group about e-cigarettes. So behind all this tobacco use, China has a very powerful tobacco industry. It is state-owned. The China National Tobacco Corporation produces over 40% of the world's cigarettes. This graph shows you the geographic distribution of tobacco production in China. Top 4 provinces here are Yunnan in the south, Hunan, Henan, and Guangdong province also in the south. And please take a note at the 2 highlighted provinces here, Henan and Guangdong, as they're also in the lead for e-cigarette production. So now, let's take a look at the e-cigarette market in China. Please note that there's no government officially published data on e-cigarettes. And the data I will show here is from a marketing consulting firm. And you can see the citation, the source here on the slide. This was published last year. So this is the most recent data, market data I can find. So the e-cigarette market has grown significantly in the last decade, actually. This slide only shows you the last 5 years. In 2019, it was 7.86 billion yuan RMB in 2019, and it's expected to continue to grow, but probably at a slower pace due to some uncertainties around policy and regulations, which I will explain or elaborate a little bit later. And we talked about the geographic distribution of combustible cigarettes just now in China. I thought it's interesting to show this geographic distribution of e-cigarette companies. The top 3 provinces are Henan, Shandong, and Guangdong. If you recall, Henan and Guangdong were also top tobacco manufacturing provinces. Something that's really staggering about this slide is how the number of e-cigarette companies has mushroomed since 2011, from just below 5,000 companies to 35, close to 35,000. So that's a 7-fold increase. So by talking about all of this, I just wish to give you like a big picture background to talk about our paper so that you know the setting. So without further ado, let me present the findings of the research that my colleagues at China CDC and I have done. So this research paper was published in Tobacco Control in October last year. So we looked at the data from the 2018 China Adult Tobacco Survey, and we wanted to understand the level of awareness and prevalence of electronic cigarettes among Chinese adults. And here, adults definition is used here is age 12, 15 and above. And we also want to understand what factors such as gender, age, education, urban or rural residential situation, whether they're associated with e-cigarette use. And we also want to understand a little bit about the reason why people use e-cigarettes. And then there's just a little bit, if you don't know, not familiar with GATS, the Global Adult Tobacco Survey. So this is really the China Adult Survey, Tobacco Survey, use the same kind of global standardized methodology. And it was conducted in 2018 by the China CDC, China Center for Disease Control and Prevention. It also, so it's globally, it's using a global standardized methodology so that we can compare across countries where such survey is conducted, right? And this is a nationally representative survey with a total of over 24,000 households from 200 counties or districts from 31 provinces, provincial level jurisdictions sampled. And the response rate was quite high, it was 91.5%. And this is just the key findings from the results. First, we look at awareness. So basically we ask the question, have you heard of e-cigarettes? And the result is that we found 48.5%. So basically half adults age 15 and older had heard of e-cigarettes. But the proportion is different, varies depending on gender and depending on age group, which group they fall in under, and depending on education. So people have, for example, people who have higher education like college and university degree, the proportion of having heard of e-cigarettes was much higher, 77%, compared to other people who have a little bit lower education like high school or even elementary school. And people who live in the urban area are more likely to have heard of e-cigarettes than people who have lived in who live in rural areas. And similarly, people who are younger are more likely to have heard of e-cigarettes than people who are older. And among current smokers, of course, this is a given almost. So they're more likely to have heard of e-cigarettes. But this is among the Chinese adults age 15 and above. And then we look at the result, the prevalence. So we asked, have you ever used, the usual question, have you used in the 12 months, and are you currently used, meaning the last 30 days? And this is the number we have got. So 5% for ever use, 2.2% for last 12 months, and less than 1% for current use. So this is 15 and older overall. But then we break it down by age again. And younger people showed highest prevalence. You can see people in the age group between 15 and 24 years old showed the highest rate of ever use, last 12 months use and current use. So their current use is 1.5%, and ever use is close to 8, it's 7.6%. And then it's interesting to find out, we did association study. So we found that people who have a younger age, so fall into the category of 15 to 24 years old and have a higher education, and who have used combustible cigarettes daily, are more likely to use e-cigarettes. But these are only among males. We only did association study of, among male users of e-cigarettes. So, and then we find this dual use. Among all e-cigarette users, 90.6% also used combustible cigarettes. And the most common reason for e-cigarette use was smoking cessation. So almost half of them say they use the e-cigarettes because they want to quit smoking. And among average smokers, it's interesting to find that 9.5% of ever e-cigarette users had quit smoking. So these are the people who have tried, used once, or currently use, who have used e-cigarettes. And they said 9.5% said they have quit smoking. But then interestingly, 21.8% of never e-cigarette users had quit smoking. So I will come to the conclusion or need for further research later. So the conclusion is awareness and prevalence of e-cigarettes among Chinese adults. When we look at the 2015 data and then the 2018 data, so there is clearly an increase. Awareness has increased from 40.5% to 48.5%, and current use has also doubled, almost doubled, from 0.5% to 0.9%. And daily use among current users, this is among current users of e-cigarettes. So daily use also have increased from 3.1% to 10.7%. And this current use represents about 4.4 million current users of e-cigarettes, and bringing the total e-cigarette users to over 10 million. And about 1.1 million are daily users of e-cigarettes. So, and then further, like I explained earlier, e-cigarette use among males were associated with younger age, higher education, and daily use of combustible cigarettes. There is a high level of dual use, meaning people who use e-cigarettes, most of them also use combustible cigarettes. And average e-cigarette users show lower quit rate compared to never e-cigarette users, questioning the cessation utility at population level of e-cigarettes in China. There are some limitations of the study. I want to just point out two important ones. So young people may be underrepresented in the sample, especially in rural area, because this is household survey. When the survey was conducted, some young people may be living out of the households. So we used weighting and post-stratification adjustments to try to make up the limitation. And then people who live in collectively in places such as student dorms, nursing homes, were also excluded from the survey. So this means there is a possibility that the prevalence of e-cigarettes use among people aged 15 to 24 shown in our study might even have been underestimated, even though they show the highest use prevalence compared to other age groups. So recommendations is pretty simple, and I will go into the current policies around e-cigarettes in China later. We think the evaluation of the implementation of current regulations is very much needed to understand their impact or effect, whether it's working. And then regulations of e-cigarettes are also urgently needed to prevent further increase among young people. So these are the key recommendations. And before I go to talk about the China regulations of e-cigarettes, I'd like to show you some key findings from another survey. The reason of that is because I just show you particularly the alarming trend of younger people from 15 to 24 years old in the China adult survey, tobacco survey. And this is a different survey. This is a middle school and high school student survey. So it's from the age of 13 to 18. Middle school students is 13 to 15, and then 16 to 18 is the high school students. And it actually shows pretty consistent findings. So based on this survey, less than 3% of middle school students use e-cigarettes currently, compared to 1.2 in 2015. So when this was conducted, this was released in 2020, and this survey was conducted in 2019. So in 5 years, it almost doubled. I know it's still low compared to some countries, but this is the trend that we're concerned about. And this is the first time high school students were surveyed. So we didn't have a comparison, right? We didn't have a baseline. So at this point, when the high school students were surveyed, 2.2% of them currently use e-cigarettes. But if in China, there are regular high school. There are also this career path called vocational high school. So among vocational high school, it's even more alarming. The rate was much higher at 4.5%. And the rate was even the highest among male students from vocational high school at 7%. And this is the awareness ever use. The tallest bar is awareness, and then the second one, ever use, current use, and intention to use e-cigarettes among middle and high school students. What's interesting here is you can see the intention to use is higher than than the current use. And among students who use both cigarettes and e-cigarettes, an interesting finding is younger students had a higher proportion of having used e-cigarettes first. So specifically what we mean was, it is among those who use e-cigarettes and cigarettes, about 30% of middle school students and 20% of high school students use e-cigarettes first. But you look at the number, the percentage among the 7th graders and the 12th graders. The 7th graders, it's almost 38% of them use e-cigarettes first. And then 16% of 12th graders use e-cigarette first. That shows you that the younger the kids, the more receptive they are to e-cigarettes. And among current cigarette users, about 15% of middle school students used e-cigarettes first, compared with 9.8% of high school students. So middle school students also are more likely than high school students to have used e-cigarettes first. And dual use. The dual use percentage is higher among high school students than among middle school students. And I'm wondering why when I was looking at this data, right? So if you look at the high school students tend to have a higher prevalence of combustible cigarettes. So they're also then more likely to be the dual users than among middle school students. And another possibility, probably because middle school students started with e-cigarettes first. So they may not be, therefore the dual using prevalence rate is probably not as high as among high school students. So the conclusion, 3 key points here. Use of e-cigarettes has increased among middle school students. This is because middle school students, there was a 2014 study, and after 5 years, the 2019 study, the same questions were asked about e-cigarettes use, and there was a trend of increase. And among current e-cigarette users, the proportion of dual users was higher among high school students than among middle school students, as I just explained. And among those who used both e-cigarettes and cigarettes, younger students had a higher proportion of having used e-cigarettes first. So those are the conclusions. So what does all of this, what do all of this mean? What are the implications? Before we try to answer that question, I think it's important for us to understand a little bit about the political or policy context of around e-cigarettes in China. So these are the current policies regarding e-cigarettes in China. It also evolved a little. So in 2018, there was a notice banning, government official notice banning sales of e-cigarettes to minors. And this notice was issued jointly by the State Tobacco Monopoly Administration and the State Administration for Market Regulation. A year later, another notice was issued by these 2 agencies jointly, urging e-cigarette manufacturers and sellers to stop selling and stop advertising e-cigarettes through online channels. So this is the online selling and advertising ban. And then in the same month, there was also another notice jointly issued by 8 government agencies, also including STMA, the State Tobacco Monopoly Administration, saying promoting e-cigarettes as a cessation tool was prohibited, and also ban e-cigarette use in public places was encouraged. So basically, local governments are encouraged to ban e-cigarettes in using e-cigarettes in public places, and sales to minors, especially through the internet, was prohibited. And then a year later, China National People's Congress passed a law called the Minors Protection Law. This is a huge law, covers many areas and many fields. So this law also bans explicitly the sales of cigarettes, including e-cigarettes, to minors, and prohibits smoking and e-cigarette use in schools and other places where minors gather and conduct activities. March 2021, so this year in March, the Ministry of Industry and Information Technology issued a decision. The decision is to amend the implementing regulations of the tobacco monopoly law of China to include e-cigarettes as part of the to bring e-cigarettes under the mandate of the tobacco monopoly law. So what does that mean? So means if this decision is adopted, then the State Tobacco Monopoly Administration will be the agency in charge of the implementation of the tobacco. Let me go back. So that means if this decision is adopted, then e-cigarettes will also be managed and supervised and controlled and regulated by the State Tobacco Monopoly Administration, just like combustible cigarettes. And in addition to all of these national notices and policies and laws, there are some subnational smoke-free or tobacco control laws that covers e-cigarettes, meaning e-cigarettes are prohibited. Use of e-cigarettes is prohibited in indoor public places. So for example, Shenzhen and Hangzhou are two examples. So I have a little bit more time. I think it's also important, that's a part of the China presentation. I thought it's important to put this into a global and even regional context. So WHO just released the Global Tobacco Epidemic report in 2021 in July. So this is fairly new, about 3 months new. And the theme of this report is on electronic nicotine delivery systems. I just want to reiterate WHO's position and some key messages from the reports. So they are listed on the left side. Ends are not without harm, and the extent of these long-term harms are not fully understood yet. And because diversity and the rapid evolution of the products, it makes regulation very challenging. So far, 84 countries have no regulation on ends. And tobacco and related industry interference are undermining tobacco control efforts. And lastly, but not least, marketed e-cigarettes, so electronic nicotine delivery systems, are marketed as cessation aids, but the potential for ends as cessation aids is still under debate. So it's still inconclusive. This is a current and projected trend of ends sales. You can see the gray line is the Western European and other countries, and then this is by United Nations regions and not by WHO regions. So this is the blue line here. This is the Asia Pacific countries. That's where the WHO, the WIPRO region, my job is most concerned about. So you can see it's catching up. It's quite, the trend is alarming. And then let's look at the electronic nicotine delivery system in terms of by low income, middle income, and high income countries. So this is the orange means sale is banned, and then the blue means full or partial measures, right, in regulating e-cigarettes or electronic nicotine delivery system, to be precise. And then the gray one means no measures. You can see low and middle income countries largely have no regulations of ends. Okay, so this is to take a close look at the WIPRO, the Western Pacific regional region, and the gray bars, the gray part is no measures or ban, no regulation, nothing. And then the small proportion here is the sale of ends is banned, and the others are full or partial measures adopted. So that's the general picture of regulations of ends in the Western Pacific region. And this is my last slide. So really, when it comes to regulation of ends and similarly END, non-nicotine delivery system, WHO's recommendations are just basically 4. So when you consider regulating e-cigarettes, there are 4 principles: is to prevent the initiation of ends and ENDS use by non-users and youth, with special attention to vulnerable groups. And secondly, is to minimize as far as possible the potential health risks to ends and ENDS users and protect non-users from exposure to their emissions. And thirdly, to prevent the unproven health claims being made about ends and ENDS. And lastly, is to protect tobacco control activities from all commercial and other vested interests related to ends and ENDS, including the interests of the tobacco industry. So these are the 4 key principles to consider when countries taking or considering taking policy actions against ends and ENDS. So I think I will stop here. I think I may have talked too fast. So thank you very much for your attention and time. And if you have any questions, I'm happy to answer.
Oh, that's fantastic. Thanks so much. And I really liked how you presented, the data on use, information on the industry, as well as the policy side. So really nice, comprehensive presentation. Thanks so much. So there is already a question for us, so let me raise it with you. So there's a asking about flavors, nicotine formulation, like whether it's a nicotine salt, and nicotine concentration, and whether those issues and types of regulations are being considered in China now, or nothing. Do you want to just speak to those issues?
Yeah, the problem right now, a huge challenge, not only in China, but also elsewhere, right, is testing. We don't even know what's in the so many kind of e-cigarettes. We don't even know what's the proportion that contains nicotine and what's the proportion doesn't contain nicotine, and what is that nicotine salt or is that nicotine liquid? But we don't know. So there's no testing. Very, very limited testing. I saw a testing report done from 2 years, 3 years ago, but it's just a snapshot. So we really don't know the answer. So not knowing that, I think that's really, we need to fill the research gap there. It's really first to understand what's in the market, what's available, what's in the product, and then so that we can inform policymakers. Yeah.
Yeah, and with the latest policy development that you mentioned earlier this year, that the STMA might be, that e-cigarettes might fall under the purview of the STMA, I guess, then would that mean that the current policies regarding cigarettes in China would automatically apply to e-cigarettes as well, or not necessarily?
First of all, there is not there's not a lot of policies like according to WHO, the highest achievement, FCTC, the demand reduction measures, right? None of them has been put in place at a national level. So WHO's recommendation to, because that decision that I was just talking about, they released that decision for public comment. So WHO submitted comments, was that because there was no STMA has not, as a part of the FCTC implementation mechanism, have not put in national level tobacco control policies in place yet. So then they are regulating e-cigarettes. So that's really unclear. But I don't, to answer your question, there's no policy to be applied to e-cigarettes, right? There's no national level, there's sub-national smoke-free policies, but there's no graphic health warning. Oh, there's a TAPS ban, but TAPS ban is not, for example, CSRs are not explicitly banned. But then they are banning e-cigarettes advertising online anyway, and they're banning it through to sales to minors. So I'm not sure how that would be transferred to e-cigarettes, because it's not the policy regulating cigarettes are just not there.
Yeah. Well, I mean, there are no graphic health warning labels yet, but there is a warning label on cigarettes, but obviously room for improvement there. So with the what we're seeing is I mean, I think you showed compelling data about youth and e-cigarette use in China, that it's increasing, that the prevalence is higher than among adults, and that it seems like the younger people might be using their e-cigarettes before then starting to use cigarettes. So a lot of concerning data. Is there a sense in the, among the government or civil society in China that, this is alarming, that one of the things that has to be done is to reduce or eliminate flavors in e-cigarettes to reduce appeal? So that was a big impetus in India for India's e-cigarette ban. They were concerned, they didn't want e-cigarette use to spread among young people and just ban the sale. But I guess how much are people, is there a sense of real concern, and that this is a lot? Like, I see the data as alarming, but is that the general sense in China, or not so much?
I just don't think the awareness is there yet. So the government so far has been saying e-cigarettes are harmful. Don't use them. E-cigarettes are harmful, but you can see these young kids on the streets, more, even girls. I think, anecdotally, I see a lot of girls using e-cigarettes. And I think that yes, there's some awareness about harms, but not enough, not consistent not constant enough. It's more at a ad hoc basis. There's just, the awareness is still very low, and people are not yet very concerned about e-cigarettes at the population level. Yes, of course, some people are like, this is nicotine addiction. So some people are concerned, but that's not the norm that I have seen.
Okay.
Yeah.
And you just raised the issue of, seeing young females using these products. I think one of your slides for young people, I think, reported, if I recall correctly, that males in vocational schools had a higher use of e-cigarette use. I don't know if if the numbers are big enough to see any differences by sex, just like in the middle schools and the high schools, and whether the difference between sexes is less than what we see with cigarettes.
Yeah, that's actually, let me see if I can, um, for mostly the data still shows still largely the proportion is much higher among males. The gap in terms of between male and female for e-cigarette users, whether the gap is smaller or than compared to combustible cigarettes, I don't recall there's a big difference. If I recall, it's also big gender difference, but the gap is not closing for e-cigarette use. But let me verify that and get back to you, Joanna. That's a very interesting question.
Yeah, no, that's fine. Yeah. So just switching gears a little bit, going back to the very big picture of China's economy.
Yeah.
So there's a question here about, and I don't know if you have any insights on this, but how much e-cigarette producers contribute to China's economy by exporting e-cigarettes, or even
exporting.
Yeah, anything that exporting or even within the country. Because it seems like we hear that a lot of products are coming from, like, to other countries are coming from China, and you showed the tremendous growth in number of companies, e-cigarette companies in China, which was like unbelievable, 34,000.
I don't know the number, Joanna, but based on the marketing consulting firms data, that is most e-cigarette manufacturers or businesses direction. They are basically producing e-cigarettes to export. So they see a huge potential market for them compared to domestic. Now, of course, they want to develop domestic as well. But according to that report that I showed at the beginning of the presentation, yes, a large percentage of the business is exportation. But I don't know the actual number in terms of volume or sales or export. Yeah.
Yeah, no, that's great. And that answers one of the other questions in the chat. And then also, I mean, one of your slides showed, different types of e-cigarettes classified, disposable tanks, various things. Do you have a sense of the most common types of e-cigarettes used in China? And then, so that's part one. And then part two, are they mainly nicotine delivery, or do you know if they're used for other substances, including THC?
Oh, see, THC, I doubt. But there are all kinds of things, like people put some, like, called it the energy bar or energy stick, or they tea, they put tea in there, they put vitamin E in there, so all kinds of things in the market that they claim to be like really healthy, right? And then another difficulty challenge is people in a lot of countries don't differentiate HTPs from electronic ends. So I assume when we ask the question, do you use electronic cigarettes? Maybe some are heated tobacco products, or HTPs, are not what we call the electronic nicotine delivery system. So that's also another challenge. But in terms of like their open system, closing system, I have seen both in the market. But then again, there's no really comprehensive market survey, so we cannot know precisely the bigger picture, what's there comprehensively. Yeah.
Yeah. And then you just brought up heated tobacco products. So how are they seen from a China regulatory perspective? So you said the STM. Yeah, go ahead.
Yeah, on paper, it's not allowed here. There's not, but people can buy them online, or Jingdong JD from Taobao, I don't know where they go, if they get them, they can, but on paper, they are not allowed. Yeah.
Interesting.
So,
Okay.
yeah.
They are banned. Okay. One person asked if there are any opportunities to work, I guess on these data, hopefully with you, but where you are with the WHO, do you have any student intern opportunities or other kinds of volunteer opportunities?
Sure. I am actually relatively new to the regional position. So I'm sure there's some internship opportunities, but I have to find out what the rules are. So feel free to get in touch with me. So Joanna, feel free to give my email, and let me figure out what's required, what opportunities exist.
Great. And let me ask you, with your recent move to the regional office, do you find similarities and differences with how ENDS and NDS, electronic non-nicotine delivery systems, are viewed, and the regulatory approaches at the WIPRO office versus China? Is it mostly similarities, mostly differences across the countries in the region?
You mean the WHO? WHO at the 3 levels, the country office, and we always call it one WHO, right? Regional office, country office, global. We have consistent position around e-cigarettes. I know a lot of people question the Europe report that was released last year, but if you read them carefully, if line by line, it's really consistent from the decisions coming out of COP6, COP7 even. So it's really just the 4 principles I just mentioned at the end of my presentation. That is the WHO position. Number 1, the e-cigarettes, electronic nicotine delivery system as a cessation aid, that's still being debated. That's inconclusive. We simply don't have sufficient evidence to say they can help smokers to quit at the population level. Number 2, ENDS are not harmless. And when you consider harm, you have to consider a range of factors: how it's being used, whether it's being manipulated after sale, and who used them, compare the benefit of smokers using e-cigarettes versus the harms of young people starting to use e-cigarettes. All of these factors you have to consider. So, and then e-cigarette, like I said, is not harmless. It has some robust studies showing it has some health consequences, though the long-term effect of emission from ENDS, we don't know. It just simply these products are not long enough in the market for us to do really robust scientific and study with certainties. So that's the situation we have right now. But because considering the younger generation, considering the flavors, considering how the e-cigarettes industry is really similar to the tobacco industry in the terms of a lot of marketing tactics. Look at the US, the use of e-cigarettes among youth is just unbelievable, right? So we recommend, if government have not banned ENDS, they should strictly regulate them so that we can protect our kids. So those are the key messages across the board from WHO.
They're very helpful, those principles, but then I think there are differences in how countries, some countries have gone farther.
Oh, yeah.
So there are currently very few regulations on e-cigarettes in China at the moment, but of course other countries have gone further. Well, this has really been fantastic. I really appreciate you sharing the data again on use, on the industry, on policy, focused on China, a little bit on the regional and global stage as well. This has been really helpful and informative. I think because China is sort of the heart of the e-cigarette manufacturing industry. It's always interesting to hear what's happening with these products in China itself. So I really appreciate you taking the time, being here with us today, and wish you a very good evening.
Thank you, Joanna. Thank you, everyone, for your time. My pleasure. Bye-bye.
Bye-bye.